I am Dr. Keerti Sachdeva. I am a counseling psychologist. I have done my PhD in psychology, and in my clinic named Positive Vibrations, there is psychological counseling testing and therapy that takes place. Today I am going to talk about depressive disorders, or commonly known as depression. What is a depressive disorder? Depressive disorder is a psychological disorder which comes under neurotic category, and the symptoms are that person feels dejected, that person has got feeling of suicide, person feels lonely, worthless, hopeless, and has got sleep problems, eating problems, and has got no focus or concentration in work. Now, what are the types of depressive disorders? There are three types. One is dysthmic depression, second is clinical depression, and the third is bipolar disorder. Now, first one when we take up, which is commonly found in people, is in fact bipolar disorder, and this is found more commonly with ladies and adolescents. Now, let us talk about the second type, which is the dysthmic depression. Dysthmic depression is a long rooted depression which may be present in a person for a long time, and person may not come to know about it unless and until the person goes to a professional. It can also be treated with medicines and counseling, as well as the other disorders which can also be very beautifully treated with medicine and counseling. The third type, which is most commonly found in ladies and adolescents, is also called as clinical depression. Now, clinical depression has also got the same symptoms as we discussed in the beginning. The symptoms are that person feels low, depressed, lonely, dejected, and has got sleep problems and eating problems. Person may also have suicidal tendencies, and this can also be dealt nicely by taking counseling and with the help of psychiatric medicines. Now, how can depression be dealt, and in what way people should take care about it? They should first in fact seek the help of a psychologist who will take the first hand diagnosis, and if at all the depression is beyond borderline cases, then the psychologist will ask you to take help from a psychiatrist who will give medicines, and alongside counseling will also happen. Now, this counseling can be taken by a professional counselor who actually should be a psychologist by profession, meaning that person must have taken a higher degree in the field of psychology, who is a professional in the field of mind and behavior. Now, what a counselor does is the person has got in-depth knowledge about what are the various therapies used in dealing with various kinds of disorders. And when we talk about depressive disorders, the main the most important therapy which is used is cognitive and behavioral therapy. Sometimes people also use rational emotive therapy, which people may not know about, but cognitive therapy actually talks about dealing with your intellectual side and in what way you can change your thought process, perception, observation, analysis, and in what way you can implement these changes in your behavior, all put together. Even reducing your emotions, which is a rational emotive side of the therapy, works very well with people when it comes to depressive disorders, and they can actually become perfectly all right when they take counseling and medicine both put together. For more information, you can contact me through lybrate.com. Thank you.